I'm Dr. SEMRAU. I'm the director of the Better Birth program here at Ariadne Labs, and I'm a maternal and newborn health epidemiologist who's been working in low and middle income countries for about 15 years. Each year, 300,000 women and 3 million newborns die during childbirth. Focusing on maternal and newborn health is an area where we know we can make a difference. In 2009, the World Health Organization and Ariadne Labs collaborators, as well as 50 experts, came together to draw out from all the WHO guidelines what are the key practices that should be adhered to for every mom, every baby, in every delivery. "294 sites implemented the checklist with a focus on how do you improve the quality of care that's being provided to women and children at that facility. We know that just handing over a checklist or a piece of paper is not going to be sufficient. And here at Ariadne Labs, we are really invested in trying to understand what makes implementation successful. What are the strategies that are most effective in a variety of contexts, and actually putting monitoring and evaluation around those implementation strategies to try and actually measure, quantify, what are the impacts that are being made.
So my name is Dr. BULBUL SOOD. I'm country director of JAPAIGO in India.
I'm ISMAELE FUSCO. I come from Italy.
I'm Sarah El-Tijani Said from Republic of Sudan.
My name is Maria Fernandez ELORRIAGA. I'm from Spain.
I'm Rosemary Ogu. I'm an obstetrician gynecologist. I look after pregnant women.
We started implementing the Safe Childbirth Checklist program in 2012.
Our main goal was to improve the quality of care of women during childbirth.
I went to Mexico and I realized that antenatal care and maternal care was really quite poor.
From where I come from, being pregnant, giving birth is a high risk. The chances of dying is quite high.
We don't want any woman to die when they're giving birth. But the fact is we're having avoidable maternal death.
Childbirth particularly is an incredibly complex process, and having some sort of standard by which to guide your practices during labor and delivery is really helpful so that key things are not missed.
We don't say that everything they've been doing is not working. It might be working, but it may not be done the right way. So the bigger challenge is to change actually the practice, to change the behavior.
I think coaching is the best strategy to implement a tool like checklist.
So you coach them, they coach the others, and the others also coach the others. That's how the whole team is going to change on the behavior and start implementing the checklist.
We realized that it's much more complex than you thought it to be because it's contextual. There are a lot of contextual factors.
So a lot of those first steps are really working with leaders and then making adaptations as necessary while upholding the essence of it, which are those evidence-based practices.
It's been important in Ethiopia because they have a huge volume of patients coming through. The resources are quite limited, and at times it can be very, very difficult to give the care to patients that you really want to give.
We are people, we are human beings. Some principal points and practice can be missed during the rush hours.
There has been ample number of deliveries that I have done in Delhi. Difficult deliveries.
She's ruptured membranes. She has sepsis already, but the signs are not showing yet. And she doesn't give you the information because she doesn't know it's important.
There has been times where I felt helpless. There has been time where I doubted my own practices.
And maybe by one act of omission or commission, you don't ask. And she stays with you. And then the sepsis, by the time it shows the signs, it's too late to do anything, and you lose that woman as well. So it's really traumatic, it's devastating. And there are things that we can do, and that's why I believe so strongly in the checklist.
It was not just a piece of paper. It was a reminder. It was a reminder for people at the facility to realize what are the things that they have to do with every client, every time, and at the appropriate time.
What we have seen the biggest changes in are just changes in teamwork, dynamics, communication, a lot of the things that are actually hard to measure.
We start with checklist and end with identifying many gaps in knowledge, in equipment, in tools.
I'll give you an example. On the checklist, we say, before you do any vaginal examination, you must wash your hand. So when you say you must wash your hand, so water and soap should be available. So that was already changed into the organization, because in the past there might have been not be water.
It's allowed us not only to improve care but also to identify areas that we could focus on, like the training. We've been able to introduce training to improve equipment supplies, and it's really not just been a checklist, it's led to a lot more than that.
I think it's important to remember that the checklist is part of a broader quality improvement initiative, and I think it's really important to understand how it integrates into the broader health system.
We introduced the checklist as a project that included lots of different things, and the checklist acted as one component of that. So overall, the project has made a huge difference.
Our fresh stillbirth rate has actually dropped by half with the checklist intervention itself. And our maternal death, as we are talking about now, has dropped to 0.
Every time you're making the choice to adhere to some of these evidence-based practices, you're actually impacting the woman's experience during one of the most important moments in her life.
It's really quite a privilege to be a part of that and to make that experience special.
As a professional, it's like you go home knowing that you did the best.
So the checklist is a powerful tool. On its own, it won't do much. It's a checklist. But if you use it the way you're supposed to use it, if you know the gaps, if you make amends or prepare for the gaps, then the checklist helps you to do so much so that no woman dies while giving birth.